her bio is in your program, but I will just give you some brief numbers. She's been the President and Chief Executive Officer of the South Central Foundation in Anchorage for more than 20 years. They provide health and related services to 65,000 Alaska Native and American Indian people in an area that is over 100,000 square miles of territory. They jointly own and operate a 150-bed Alaska Native Medical Center that supports over 140,000 people statewide. And as the CEO, she oversees 1,750 people, administers an annual budget of $210 million, and manages more than 90 healthcare programs and services. Ladies and gentlemen, please help me welcome to the podium Dr. Kathryn Gottlieb.
Let's see, last night I was at the event, the cultural night event. That was great, and I loved the procession that came in and honoring each of your regions. I love that. And but I just want to talk a little bit about last night's ceremony and a little bit of the recognition of, is it Yuri? Is that the correct name? Yosef. Well, it's okay, he could add that one to his names. And I identified with him so much because, you know, he's short. They brought me this stand. If I put that there, I'd be way up here. But so I said, no, it's okay. I'll just leave that over there. Do you see it? I'm not joking. Do you see that right there? And then he talked about his years of service, and I've been involved, and my whole career has been with Alaska Native American Indian people and serving them in healthcare. So I identified with that. And I also identified with people calling him Hercules, and what else did you guys call him? You know, Muhammad Ali. Because people would come up to me and say, boy, I thought you were a lot taller. And I just always keep telling them, no, I'm a short, cute Aleut. But anyway, I just want to say, Chamai, Chiefs, Aganak, Nagosbek, Suluktra, to be here this morning. We, Kathryn Gottlieb Tsunami, at Anchorage, we, Anna, Supiak, Margaret Shugak, and Tata Filipino Alfred Kianse, Bujna, Swittenhoden today. So hello, chiefs, elders, tribal leaders, ladies and gentlemen, I'm happy to be here this morning. My name is Kathryn Gottlieb, and I'm from Anchorage, Alaska. And I'm a tribal leader and member of 3 tribes. I serve on them as a council member, one of them as a council member for the Soldovia Village tribe. And my mother's name is Margaret Shugak, and she is Supiak, and my father's name is Alfred Kianse, and he's Filipino. And I just want to ask God to bless us today. So I want to say koyana to Joe Gallagher and the First Nations Authority for the invitation to speak today. And I was just here in Canada, in Ontario, Canada, and I was with a group of your people and with several of your chiefs. And I just want to name them and recognize them because we were invited by them. And that was Chief Sawyers of Garden River First Nations, Chief Paul Ashkako of Sagamok, Anishinaabeg, and if I apologize already for saying the names wrong, but I'm going to make that giant attempt. Chief Alfred Bisalian from Thessalon First Nations, Chief Shining Turtle from Whitefish River First Nations of United Chiefs and Councils of Matulan Islands Tribal Council, Tribal Leader Angus Tolosi, CEO of the North Shore Tribal Council, and Robinson Huron Treaty Territory, and leaders Cheryl Hangert, Traditional Health and Healing Coordinator, and Lisa Meswagi, Mental Health and Additions Manager. And if you're in the room today or represent the areas, would you please stand with me and our South Central Foundation family, Alfred and Helen Kianse, FWWI committee members, Dave Favre, OTP Executive Assistant, Dr. Donna Galbraith, and Caitlin Stuman. If there's any of those that I've named or areas that I've said that are represented in the room, would you please stand with me? Would you give them a hand? I want to recognize them because they've joined our tribes in Alaska to end domestic violence, child abuse, and child neglect in this generation. I heard yesterday in many also of the speeches that you're practicing decolonization and you're doing big partnerships and you're gaining more and more control of your health care in health and wellness in the First Nations, and that you're now the family of the Wolf Clan. You're also now recognized as the family of the Wolf Clan and First Nations Health Authority, and I just want to applaud you for that. Can we give you a great big applause for that too? And then I was told, and I love to walk around and listen and hear about your population, your indigenous population. We have 232 federally recognized tribes in Alaska. That's half of the nation's federally recognized tribes. The other half lives in what we call the lower 48. But yesterday I was visiting with you, and some of you said there's over 140 chiefs in your conference. Can you ask them to stand right now? Would that be proper for me to ask them to stand in this room? Would the chiefs please stand of your First Nations people? You must be so proud to have that leadership attend with you and support what you're doing. That is so strong, it's so powerful to have them present today. And I just felt that. I thought it was very powerful to hear this. I thought it was so strengthening when we showed up in Ontario to do our work with them on the third year. We've been with them for 3 years of this work. And for them to show up and be there and be present, it's amazing to me. I want to pause and just tell you a little story. And I think that you as First Nations people are going to understand this story. And it's part of our health and wellness journey. We're a people that had our control taken away from us. And other people came in and controlled us. And things came in and controlled us, not just people. And when that happened, and they exercised the control over us, we lost and we were stripped of many things. We were stripped of our language. And so this morning I'm practicing my language, and I'm doing it for the first time, and I want to give you credit for that. My brother got pushed when he was in Ontario, Canada, to bring his culture, our culture. He was raised by our grandmother. He was the only one raised out of 12 siblings by our grandmother to learn the Supiaq culture and the language. And he's now extending that teaching to us, to his siblings and to his young relatives, because the cousins and the young ones want to learn. And so we were stripped of our language. We were not only stripped of our language, we were stripped of our culture. We were stripped of our spiritual beliefs, and I'm going to stand here right now and tell you I believe in God, and it's tied into our mission and our vision statement. I'm going to proudly say that, and I'm going to say I proudly believe in Christ, and I'm going to stand here and proudly say that. And I spoke my language and my culture. I'm wearing my regalia. Part of my dress is a kuspuk, because our leaders, our tribal leaders, said we're stripped of that. We're stripped of our country. We're stripped of our privileges, and we're stripped of our rights as human beings. And the result of that is we became despondent. We became suicidal. We reverted to substance abuse, and we started alcohol abuse and all kinds of violence. And it's a true story. It's what happened to American Indians and Alaska Natives throughout America. But I will tell you something. Our leaders, our chiefs, they rose up and they began an awakening, and they decided to fight back, but not in the same way that our ancestors did, because you know how our ancestors did it and what happened during that whole war. But they didn't stop. They rose again and they started fighting again. And this time we chose Western methods and Western ways, and we went through the judicial system. And we fought back and we changed laws. We went to Congress. We hired lawyers. We paid lots of money. And guess what? We won. We won. And we got lots of trust and treaty. It was long haul, and it's within my lifetime that I could recognize my chiefs and leaders who have done this. Because one of the greatest laws that they passed through trust and treaty agreements is the Indian Self-Determination Act, in which where now we as our people have assumed the role from the federal government and taken over the healthcare funds, and now we operate and manage it ourselves, and that's part of our history. So let me tell you a little bit more of that history. When we first, before we took over our hospital system, it was ran by the federal government. And I will give credit to the federal government for trying, those employees who tried really hard to try to do their service, but there's a bureaucracy to that. And we live far away in Alaska. So if you think about it, in order to make a decision, we had to ask for permission to do anything in Alaska, and it had to go all the way back to Washington, D.C. to make it happen. So to begin building our brand new construction, even though we had the money, we had $100 million to build a new facility, but it took us 20 years to get it built because it took that long to get the decisions made. So these staff and people that were working for the federal government were trying to make change but couldn't hardly do it. And so the way that we had services, we showed up through the emergency room, all of our health care. So if you had a cold, if your baby was sick, if you had cardiac arrest, if you had a broken arm, it was all entry level, was through the emergency room. And if you knew anybody, if you were really lucky, you might make it up to the 2 family medicine providers on the 2nd floor. Otherwise, your emergency room, and that's where you showed up. We took over the healthcare services from the federal government, and the first thing we had to do, and if you think about it, it's Alaska Native American Indian people. We had never run a healthcare system. We only got services through the hospital, and I was one of the tribal leaders that did this. The whole state of Alaska has assumed the responsibility. So if you think about it, the first thing we had to do was begin to educate ourselves, right? How do you run a hospital system? And what do you do now? And we also had to make the choice. If we were going to make a choice to assume the responsibility for lives, that would be like, okay, I'm your tribal leader right now. I took the money from the federal government. Would you choose me to run your hospital system? Short, cute, Subiak. The answer is yes, right? I mean, you chose Yusuf, and he was short. So what happened then is our people had to do that. They had to look around, and it felt like you were choosing your aunts and uncles to be governance. And then you had to say, okay, I will do this. I will do the responsibility. I'll take over all your healthcare services, and I'll provide services to you for 65,000 Alaska Native American Indians. So we had to go, we had to educate ourselves, we had to hire the best people, we had to go out and get consultants, we had to learn and grow and figure out the ways that we were going to do it. So our journey is about a 30-year journey. And the first 10 years was just building the infrastructure, buying computers, setting our financial in order, our finances in order, getting compliance and legal and our infrastructure in place, hiring the best people to operate and manage our healthcare services, our vice presidents. I want to tell you now, the people that came into the door with me in 1987, 4 years later I became the CEO. I hired vice presidents, they're still with me, all of them except for one. And the behavioral health person just keeps like a rotating door. I don't know exactly what's happening with the behavioral health world, except for those people who left as vice presidents had reasons, like one married and left out of state, and another got stolen by Congress, congressional delegates. And so there was different kind of reasons why they left. But otherwise, the rest of the vice presidents have been with me 18 to 20 to 22 years in the growth of what we've done. Sustainability with us has been a big thing. And the board members and the governance that have been with us is same thing, longevity. So with our journey of wellness, what happened with us, it took persistence, it took sustainability, it took stay with the program, look and see where you're going, and make sure that you want to go where you're going. And we do have a vision, and I'm going to talk about that a little bit later. So I want to tell you that we had to build an infrastructure, and then it was 20 years in the making of what we've done in redesign. So it's persistence, it's taking on a role, it's keeping to the vision, and then we built an infrastructure that was so beautiful. It was tied to what our community wanted. We looked at our people, our culture, and our strengths. We chose and we united. We put ourselves together and we said, all of us 232 federally recognized tribes actually got in a room, shut the doors, just like they are now. I think I'll just not let you out of here. And that's exactly what they did to us. They shut the doors. They said, you're going to come to an agreement of how you're going to run the healthcare in Alaska. And we didn't leave that room for 7 days, 12-hour days, and came up with an Alaska Tribal Health Compact. And we came up with agreements on how to share the money. Does that sound pretty powerful? 232 federally recognized tribes. Okay, chiefs in the room. I just want you to know that wasn't easy. I know you chiefs. You know how arm wrestling you are? You're pretty good arm wrestlers. I had giant chiefs standing in front of me going, you're doing it wrong. I'm going, I know. I'm just going to do it anyway. You got to love those chiefs, I'm telling you. I have strong backing now. Actually, 3 of those chiefs who arm wrestled me in those closed doors came and gave me eagle feathers when we're all done. And that's one of the highest ways of honoring one another, is eagle feathers. So they did forgive me after a while. I'm going to quickly wrap up with a couple of slides. And we could get that PowerPoint up there. This is South Central Foundation, and we're 65,000 Alaska Native American Indians we're serving, and we have 1,800 employees, and over 55% of them are Alaska Native American Indians, because that's part of the Indian Self-Determination Act. We can do selective hiring and really hire Alaska Native American Indians on purpose. That is not discrimination. That's under the law. So our goal is 100% Alaska Native American Indians, although we don't have enough nurses, doctors, providers, and that kind of a radiologists, pharmacists, OBGYN doctors. We're looking and hunting for them. I have to pause and forgot to tell you one thing that my husband reminded me of last night. He said, I told myself, boy, I'm doing Keynote tomorrow. I'm having a hard time to go to sleep. He said, you do this in front of thousands of people. He said, and these are your people. And I said, huh? He said, the only thing that divided you was the borders. And it wasn't your people that did that. Oh, my honey, he's so full of wisdom. I just love him so much. Okay. Would you like to live in Alaska? Are you sure? Really? So everybody has a story behind their eyes, and I said that yesterday, and we did share a little bit of story behind our eyes through my brother and his sister-in-law. We won't do that today, but I did share a little bit of story about us, our history. Let me tell you a little bit of the journey, a little bit more of South Central Foundation. You just saw it. There's my uncles and aunties. Actually, they're my governance. And I just want you to know that these are the people that were in the video. They've been with us for many, many years. 2 of them are with our tribal authority. And then they select our board of directors, which there's 7 of them, and these are all Alaska Natives from our region. These are my children. This is our new regalia. Our culture is coming back. We do our dances in these regalia. my eldest daughter on the far, I don't know if it's your left or right, and then there's another daughter, and my granddaughter's here in the picture. This is why I do this, why I do this. I care what happens in 100 years. I have 28 grandbabies, and I have 2 great-grandchildren, and that's the other thing I'm identified with what's his name? Joseph. You can't guess how old I am either. So why listen to our stories? All of you providers in the room that are interested in numbers and data, we dropped emergency rooms. When we took over in the 10 years that we have operated and managed our programs and redesigned, we dropped our emergency rooms, our hospital days, our inpatient days by 50%. That's a big deal. We don't go through the emergency room anymore. We have our own primary care providers. We have same-day access. If I want to see my provider, I call up, and I get in the same day. And I have not just one provider, I have a whole provider care team. So I have my provider, I have a case manager, I have admin support, I have a pharmacist, I have a nutritionist, I have a dietitian, I have a psychiatrist that if I need any of those, they're all on the team and accessible by me as a person. If I get to go in and see my doctor every day, do you think I'm going to do that now? Every single day? No. And you know what else? I'm building relationship with that doctor. That doctor is my friend. I know that doctor very well. He knows me. We're in relationship. It's not just about him being a provider. It's not just about me being a patient. We're in relationship, and so I'm not going to show up every day. I don't need to. I've got everything I know about what I need, and then I have relationship, and it knocks down those numbers of inpatient time. We have HEDIS measures that are very high in the nation, national recognition and national numbers. Our turnover rate with our employees is really low. It's between 11 and 15%, and that's because you saw it in the video. We have relationships. We train our people to be in relationships. We take 3 days. I'm in those trainings for all employees. All 1,800 employees have to go through this training and learn how to be in relationship and learn how to tell story, their own story from their heart, and listen to story so that we understand one another. And then we, of course, we won the Baldrige Award. We were written up in the New York Times, and this is the big deal. This is Alaska Native people doing our thing. We are the ones that have redesigned it. We took it on. We took the responsibility. We redesigned. It was Alaska Native people that changed and redesigned the system. That's 140,000 Alaska Natives in Alaska that has done this. And we did it together. And when the New York Times editor came up and he interviewed us, I loved how he wrote this article and that he put it in this light. He didn't say South Central Foundation. He didn't say Kathryn Gottlieb. He said Alaska Native people have something to teach the world. And what does that do to raise the self-esteem of population when that happens? You feel it? Yeah, who owns this thing? Yeah. This is our geographical area. That bottom half is where we serve all of our population. If you notice, see that geographical area, got horizontal lines. It's 130,000, something like that, square miles, and we all have to fly to get to those areas. We have a hub. The hub is Anchorage, and out of the hub of Anchorage, we're connected to all the rest of the 60 villages that we provide services to by air. So hub is in Anchorage, and then we have clinics out in the small areas. This is the law that was passed, and see what the federal, what Congress said, federal domination of Indian service programs has served to retard rather than enhance our services and programs for our people, and denied us an effective voice, and this is what the government recognized. If people have their own say, better yet, if they own their healthcare services, that programs and services have a potential for enhancement, and the people and their health statistics will improve. And we proved that. And Alaska Native people chose that responsibility, and I did tell you about that. This is our vision, a Native community that enjoys physical, mental, emotional, and spiritual wellness. Because we as people we don't separate ourselves. We don't say part of us over here physical, the other part is behavioral, and one part of us somewhere is spiritual. We're all one human being. And that is the vision and our culture. That's our persons, that's our people. That is how our vision came out. And our mission is to work together because we are about sharing. We're about community. We're about working together and making it happen. And so we do that with a lot of people. And our goals, again, shared responsibility. It's about responsibility, my responsibility, not just the provider's responsibility, everybody's commitment, quality. We train and groom. We have career ladders for our employees. We've trained and groomed 3 vice presidents, brought them all the way up through the ranks, from being a young person, have bachelor's degree, put them through a master's program. They got stolen. They're now 4 CEOs in the region of Alaska. They're out there. It's okay if you get stolen from us, you better get promoted. Or else I'm gonna be mad. And then it's also Center Family Wellness. We'll give you career development. We'll work with you. I'm about succession planning. I want all of you, if you're younger than me, and you don't know if you are or not, to come and take my job. Come take my job. Go back to school, do whatever it takes, go through the training, get the skills, and come and get my job. I dare you. Okay. Operational principles is all about relationships that built on this. We tie everything to the vision, mission, operational principles. I have to pause here for 1 minute. One of the successes, the big successes of South Central Foundation is having a vision that all of us agreed to, having a mission and values that we agreed to. We all agreed we're going to be customer owners. We all agreed we're going to be in relationship. We all agreed that we're going to go after that vision, and we never budged from that. For all these years, never budged, never got off the page. And that helped us drive to achieving what we wanted. And every employee that works with us knows how they're achieving that mission statement, because in your evaluation, it's written in a work initiative that's tied directly to the goal about how to achieve the mission. So if you're driving a car, and remember they talked a lot about Disneyland, we took that concept and we applied it to us. We created a mission and vision and goals that people could get and understand and live out, not just have a goals or vision that's hanging on a wall. We actually live and breathe it. And if you visit us, you'll feel it. You can feel it. So we listen to our community. We listen. We have gatherings. I love your cultural night. I mean, we have lots of things like that. We have gatherings with our community. We survey. If you come into our hospital now, you're going to be given an iPad, and there'll be a survey asking you, how was your visit? What did your primary care like? Did you get what you needed? Were they culturally appropriate? Was their provider respectful? And we'll get feedback right away. We connect. Those pictures that you saw, there was a lot of legislators in there. We invite them all the time. Come see what we're doing. Come see what they're doing. Because if there's something that happens in the Congressional Act, we're going to be connected to those people in relationships, so they'll help fight for us and with us. We changed everything, and that was everything, infrastructure, everything to make this happen. We do bill. We bill big time aggressively. 1/3 of our budget is all about billing, Medicaid, Medicare, private insurance. We will go after fund and foundations. The 1/3 is about foundation funds. Anybody who will come and save the natives, I'll let you. Just write the check. So, and I do it almost like that. You want to save the natives? We're about, and they will write the check, and we've gotten millions of dollars from people who want to help tribes and tribal organizations. And I'm always teasing them, too, afterwards. I thank them very big time. I'm in relationship with the CEOs of the foundation, but I do tease them about coming to save the natives, So, customer ownership, we call ourselves customers now, and we own it. We changed the words because people weren't being respected during the transition, or when we first came to own it. We were like cattle. We were running through the emergency room. They didn't even know us. We were numbers, not names. So we had to change the feeling, a paradigm shift with providers and us. So we began to call ourselves customers, and then we own the system. So we own the system, customer owners. And then we become active. We are actively involved in our journey of wellness. We're not passive people. We are paying attention to our health and wellness. We're looking at our bodies, mind, soul, spirit, and we're walking in the door prepared to meet that provider. And the providers are now not just heroes. They're not the hero. They're not there to save us anymore. They're in relationship with us. They work with us. They're not about compliance or blaming us. You know, it's because of you did this, this, this. They're actually walking out their journey, our journey with us, saying, how about let's do this? They're our advisors now. They're not the people who tell us what to do. They say, this is the best thing that I see that could happen with your wellness and journey. And I get to argue with that. Say, I'm not sure if I want an ultrasound today. Maybe I don't need one, I want to wait. And then we arm wrestle, and then we agree, and then we choose whatever it is. And that's another way we've driven down healthcare costs, is because we as people have now become responsible. And now we walk out the journey with providers and them not be the ones that do it. What is the challenges of change? I'm going to wrap this up now. I just have 2 more slides. Changing attitudes. It was really hard in changing attitudes, changing normal practices to best practices, taking down the walls for transparency. Change is good. We put our primary care teams all together. They work together. Our HR offices are all together. Walls are down. If you want to have a confidential conversation, you go into an office. Our transparency is glass walls in our boardrooms, glass walls in my wall. In my room, you can see what we're doing. We're very transparent. We let our board know everything. We tell them the good, the bad, the ugly. There's no secrets happening in our world. So opposition, big battles, we are willing to fight, undermining jealousy inside and out. You know about jealousy inside and out. And undermining, we have tried to change norm paradigm shift about lifting up and out. We want to honor you. We want to respect you. If you're doing something successful and you're not even in our region, or if you're not in our organization, we want to lift you up. We want to let you shine. We want to bring you out. And then within our world of South Central Foundation, same thing. If you get an award, we're going to celebrate you big time. We're not going to bury you. We're not going to pull you back. And we're not going to say, boy, we're jealous of you. We don't want you to succeed. We turn that paradigm around. Succeed. Be successful. Be great. Go get an award. Fantastic. And then be willing to stand in the gap. We as leaders have to stand in the gap. Sometimes it feels like one against the world. And I heard your speaker last night say that too. One against the world, or some of you that honored him said one against the world. It's true. You as leaders have to stand in the gap, right? And we have to go against the norm, and we have to think about outside of the box. And those were big time challenges for us. And we needed the vision. We needed to be aligned. We had to have buy-in of leadership. We had to have our customer ownership buy-in with us. And if we didn't have the backing, when I talk, I'm talking now. And if you look at me, behind me is 65,000 Alaska Native American Indian people, 1,800 employees, or beside me. In front of me is my governance. All my tribal governance, and we are all bought in together. We're walking out this journey together. I don't get to do it by myself. We're all connected. And so that is one of the big things, is alignment, creating a place of safety. Our board does not look at whose fault it is. They look at the system. What in the world happened to make that mistake? Why did that giant thing happen? It isn't off with your head. It's looking at a whole system change. Let's see what happened and fix it. Fix the system so it won't happen again. And selecting the right people, I told you that the people that are working with me, 18 to 20 years, and there's a lot of them. We were going to do a recognition in SF, and there were so many people we couldn't figure out what to give everybody. So we just said, yay, we'll just celebrate everybody being here for 18 to 20 years. And do the right thing even if it costs. And I told you, I was joking when I said my chiefs were mad at me. They were mad at me. And I did the right thing even if it costs. And now they're not mad at me, and the people are not either. And you have to do it. If you're a leader, if you're going to do it, stand in the gap, do it even if it costs. So my ending is, Koyana, thank you again for inviting me to speak with you, to share our journey. I love learning from you, and please hear us. We're learning from you. We're getting back our culture. We're hearing what you have to say. Workshop is great. Thank you. Joe Gallagher, again, for inviting me, and the First Nations Health Authority. Thank you, chiefs, elders, tribal leaders.